Hey, ladies and gentlemen, this is my attempt to do a little bit of a deep dive on the COVID numbers here in Utah and to see if there's anything we can learn about what we're going through here. Okay, I started this little spreadsheet here to do some calculations on the numbers that are being provided by the government of Utah, utah.gov COVID numbers, and then later I'm going to show you some CDC numbers. So first of all, just the numbers down here, as of 9/16/2020, in Utah, we have a population of 3.3 million. So far at that point, we had 436 deaths, a total of 915,000 tests, but that was for 725,000 people. So some of those people, I should say, each person had 1.26 tests. So there were some people have been tested several times. Of all those tests, 915,000, 59,000 were positive tests, and that represents 8.13% of all the people being tested were positive, so 8% were positive. Hospitalization-wise, at that point, we'd had 3,361 hospitalizations, and we have 68 hospitals in Utah, so that at that point, that averaged out to be just under 50 hospitalizations per hospital over the whole year. That doesn't seem like very much to me. Okay. And positives, 59,000 positives, 5.7% were hospitalized. Okay. And then just from those numbers, just doing some estimates. Okay, you take this positive test, 8.13% of people being tested are positive. Then if we estimate that across the whole population of Utah, assuming we tested everyone, at that point in time, we could probably estimate a total of 268,000 positives in Utah. And taking the percentage of positive being hospitalized at this 5.7%, that would give us about 15,000 people being hospitalized after this COVID ran its course through all of the population. And okay, looking at deaths, of the deaths, less than 1% of the positives are dying. That's 12.97% of the hospitalizations. Hospitalized people, 12.9% were dying in September. Okay, how did that change a week later? A week later, those percentages are coming down slightly. So we have so with all those numbers back in September 16th, we could estimate that 1,000 people might die from this time if this thing's run its course. But the hospitalization rate is coming down, the number of positive tests is coming down, and so the number of estimated people dying is going down to 1,000. Okay, so a month after that, I did the numbers just today, coming down even further. Hospitalization of those being hospitalized, 11.3% of those are dying. The total estimated positives is going up, and yet the death rate is going down. So of the people tested, we've tested 30% of the total Utah population, and we've had 100,000 positive tests, which means only 10% of the people tested, therefore 332,000 people could be estimated to be positive once this thing runs its course. Yet, the hospitalization rate and death rate is coming down. So, estimated deaths using the estimated hospitalizations times the hospital death rate now is going down to 1,833. Okay, and this is all based on the assumption that our total number of deaths at this point in time is 568. Now that's assuming that's a good number, but we all know that that includes people that have died for completely other reasons, but they just happen to have COVID. You know, they're being thrown in there. You know, there's a financial incentive to classify deaths as COVID deaths because the healthcare providers get more money from the government for Medicaid, Medicare patients. They can charge much more money because of that. And yet we're only for the whole year, almost to the end of the year here, and we're at 568 deaths. Okay, now let's just see how that compares to a normal year. This data is directly from the CDC for Utah, leading causes of death in 2017, okay? 568 current deaths, COVID deaths, would rank between number 6 and number 7 in causes of death. Suicides. We have more suicides in Utah in a typical year than we do with COVID. And I have a feeling for 2020, this suicide rate is going to go way up. We have about the same amount of people dying from diabetes, okay? No one's panicking about diabetes, of course. Diabetes is not contagious. But the flu, I had looked at some data between 2014 and 2017 on the CDC website for Utah, and flu and pneumonia were hovering at about 400 deaths per year. And then this category here, which it sounds a whole lot like COVID, chronic lower respiratory disease. Does that not sound like something similar to what people with COVID are dying from? In a normal year, 826. So if you combine those, in a normal year, 1,200 people are dying for these flu-like symptoms, and no lockdowns, no reason to panic, no shutdowns of schools, no masks required of the healthy. Something just is not right to me. And the media will not cover this. The only thing they want to cover is the number of positive tests. And of course, at the positive rate of now of the people tested, 10% are positive. So we could expect that if we tested everybody in the whole state, go up to 332,000. And the media would have a heyday with that and blow it way out of proportion, fan the flames of fear and panic. And yet we are seeing the death rate going down, down, down with new treatments, better understanding of the disease. To me, it doesn't look like a panic. It doesn't look like a run on the hospitals. It doesn't look like we're overtaxing our health system. And if we looked at the ages, and I've seen on CDC data that I think people under 60 or under 50 make up about, I don't know, something like 5% of all deaths. Something like that. I wish I had that pulled up right now, but I can show you too. So I'll continue to watch this, but this story is not a story you're going to get from any news outlet. They are invested in creating as much panic and fear as possible, and I believe it's politically motivated, partially. I mean, for the most part, political. There's Kool-Aid drinking people that believe all the hype that the government dishes out, but something does not pass the sniff test. And I hope to give more of these as data comes in, and maybe I can dive even deeper, hopefully. So thank you for listening.